right? So let me move to treatment. We'll get to the more interesting stuff. Right? When you're considering like whether or not someone's a forensic psychologist or is working in a forensic environment, like it's really just like who are you treating or where is that individual being treated? Like treatment is treatment. Like I'm a licensed psychologist in the state of Maryland. Technically, I'm allowed to like hang up a shingle outside of some business and start seeing patients. Like I can talk to the worried well and whatever, anxious soccer dads or whoever shows up, right? Now, should I do that? No, I shouldn't. I'd be a horrible, horrible therapist, right? For a host of reasons that we're not going to get into. But I'm legally allowed to do that because I'm a clinical psychologist and I was trained to be a therapist. But therapy's therapy. So licensed clinical social workers, counselors, psychologists, if you're doing treatment, and you're doing treatment with inmates, it's forensic psych. If you're doing treatment and you're doing it in some kind of secure environment like jail, prison, maximum security mental hospital, that's treatment, right? Because therapy is just therapy. So part of the equation is just where is it happening? And the social workers that work in jail, which is a ton, and do most of the mental health treatment in jail and do most of the mental health treatment in prison, like they're technically doing forensic psych, right? So it's just a matter of who and where. Now there's some places that I call like forensic adjacent. Like they may not seem like a forensic psych site, but they actually are, right? Halfway houses, obviously for people, if you're coming out of jail, then there's a lot of people involved in the criminal justice system in that place. A drug rehab center, like I'd venture to say that half of the people that are in drug rehab are court ordered to be there. So they're involved in the criminal justice system. Like it's a forensic site. Homeless shelters, you've got roughly like 70 to 80% of individuals who are homeless are diagnosed with a severe mental illness, and at least 65% of them are involved in the criminal justice system in some way. So if you're at a homeless shelter, it's basically a forensic psych. Same thing with community mental health centers, right, where they do sliding scale treatment or free treatment. So it doesn't necessarily have to be one of these. If you're in any of these places, you're pretty close to doing treatment in a forensic setting because the vast majority of your patients are involved in the criminal justice system in some way. So then we get to assessment. Now, the ability to do in-depth psychological assessments is what separates psychologists from social workers and counselors. Because a social worker can hang up a shingle just like I can and say, I'm a therapist. Right? In fact, the word therapist is protected in Virginia. You cannot call yourself a therapist unless you have a license to practice mental health. Right? And the way you get a license is you become a counselor, an LPC, licensed professional counselor, an LCSW, a licensed clinical social worker, or a psychologist. So any of those people can call themselves therapists. If you're not one of those, if you're not in one of those three groups, then you can be like a life coach or something else. And I'm not disparaging those, but like the reason they don't call themselves therapists, even though they might be really good therapists, is because they're not legally allowed to do that. Right? But psychologists, right? These programs, social work, counseling, they're going to be 2 years, 2.5 years of master's after your undergrad. Psychologists are going to school for another 5 minimum, sometimes longer, depending on the student, right? So that the rest of that time is spent learning psychological assessments, right? Now, outside of forensic psych, psychologists do assessments all the time. That's their bread and butter. It's like, it pays better than therapy. I'll just say that, right? But outside of forensic psych, like maybe you are a parent and your kid has to get tested to see if they qualify for a gifted and talented program at school. Something like that, right? So you take them to a psychologist, they do an intelligence test, a couple other tests, an interview, and they give you the results and you find out if you met some magic number, right? But it can also be stuff for work or workman's comp. It can be that a doctor sent you there because they need to know what's going on. It could be traumatic brain injury. But the point is, when you're not in forensics, you need an assessment for something, and for some reason, you go to the psychologist, they test you, you pay them, they give you a report. Right? That's just how it works. Nice and simple. In forensic psych, it's a little different. Right? In forensic psych, the client and the patient are not necessarily the same person. Right? In forensic, I never get hired by a person. I only get hired by attorneys. Right? And my client is the person who's paying me. So my client is the attorney. Now, it just so happens that I'm going to be testing this guy. But the money's coming from, the money's coming from here. And then when I get done with my report, I'm sending it to the attorney. And the attorney's going to share it because this person hired the attorney. Right? But the person in front of you is not necessarily the client, which can make things a little weird sometimes. Now, in your doctoral program, in any clinical psych program, they're going to teach you how to do certain assessments, right? Intelligence assessment, how to give the intelligence test, which is called a Wechsler Adult Intelligence Scale. Personality assessments like the MMPI, PAI, that kind of thing. Some Rorschach in some programs. Some basic neuropsych assessments, and then there are some other little specialized stuff. But the job of the forensic psychologist is to choose the right assessments that you need for the legal question that you need to answer, right? So if I'm doing a criminal responsibility evaluation, I'm going to want to know something about their personality. I'm going to want to know something about their signs and symptoms of mental illness, right? I'm probably going to want to know their intelligence just to get like a sense of like what they understood, what's their ability to understand the rules. And then there's a whole bunch of specialized stuff that's just for forensics that I'm not going to get into here. But the point is, regardless of what legal question you're going to answer, a psychologist is going to have to choose the right assessments for that particular thing, right? And then, now, let me just say that, like, it's a long road, okay? Because after you get your undergraduate degree, just keep in mind, when you get your undergraduate degree, you're going to have more education than, like, 60% of the United States, which is like weird to think of. It's crazy, right? But you'll have more education than 60%. By the time you get a master's degree, you're in like the 95th, 96th percentile. By the time you get a doctoral degree, you're in like the 98th, 99th percentile. But then you're talking about, right, 4 years. And just so everybody knows, you don't have to go to a master's program first. You can go straight to a PhD or a PsyD program, and you kind of earn your master's along the way. So basically, 4 years, and then all this together is going to be 5, or maybe 6, right? And then you know enough to get your license as a psychologist, right? You know, like just enough information to treat patients and probably not hurt somebody. But you may not be like, great. And then you have to go get specialized forensic training after that, where they teach you all of those instruments, the specialized instruments that you use for cases that they don't teach in doctoral programs. Because not everyone wants to be a forensic psychologist, and there's just a lot to learn before you graduate as a psychologist. So after you get your doctorate, then you're talking about like another year of postdoc education, and then you can be something close, right? But again, you'll still just have, like, you won't be a specialist in anything, you'll just have a better idea of how to be a forensic psychologist, right? Now, outside of forensic psych, right, I pay the psychologist, or the psychologist, right? You pay the psychologist gives you the report, right? In forensic psych, this is where things get different, right? The attorney pays you, you do the evaluation on the person that they're interested in, and then when you give the attorney the report, you'd be like, here you go, and you'd be all excited, and they'll be like, thanks. And then they just bin it, and they'll throw it away. And they won't use any of the work that you just did. And you're like, right? Why on earth did you I just did all this work, and I wrote all this stuff up. Why did you just throw it in the trash, right? And the answer is because it doesn't fit, right? If it doesn't help their case, then they're not going to use it. And that's where things get different, right? Like, that's their right as the owner of that report to use it or to not use it, right? And so you can wind up doing a lot of work that they wind up throwing in the bin. And so anytime I do a forensic evaluation, I always like what's the question you want me to answer, right? Give me, like, I need some blinders here. Tell me exactly what you want me to answer. And then I'll review everything that they give me, which we'll talk about. It's a lot of stuff. Like, the last case that I did, well, the last case was that was an exception. Usually I get somewhere between like 300 and 600 pages of stuff to review. And when you calculate like your hourly rate for charging, you calculate $1 or a minute per page. So you've got to go through like 60 pages an hour of, and not all, some of them are easy. Some of it's like phone records or stuff you don't need because they just send you everything. But I'm looking through between 300 and 600 pages of information, plus meeting with that person and testing them. Right? So there's a lot of work that goes into just like kind of wrapping my head around the case and what's going on. Right? So after I've looked at all the material, conducted my investigation, talked to whoever I need to talk to, before I start writing things up, because that takes a long time too, right? I'll give the attorney a call and I'll say like, hey, I just want you to know that like this is where I'm at. I talked to your guy, I looked at all the stuff, and this is my answer. I'm pretty sure this is going to be my answer to your question. And the reason that I call an attorney before I start writing is because sometimes they'll say, thanks, you're good to go. You can just stop there. Because that's not the answer they want, right? That's not going to help their case. And then I don't have to write the report and they don't have to pay me to do it, right? Sometimes though, like they'll say, okay, this is great. And then I need this, and then I'll write it up. But I always give them the option before I charge them more to say like, nope, this isn't moving forward. And when that happens and they don't like my opinion, then they may just be like, okay, we're going to abandon that strategy in court, or they may hire another psychologist and try and find someone to give them an answer that they like better. It just happens, right? And we'll talk about that in a minute. I'll come back to that process.